Substance use in teens. This video will review specific risks with substances and provide information for parents on how to prevent youth use. Alcohol. Alcohol is still the most common substance use used by youth. There are many inherent risks with teen alcohol use. These include immediate safety risks and long-term negative impacts on physical and behavioral health. Adult awareness of a standard drink can help facilitate conversations with young people. Did you know that all of the drinks on this slide contain the same amount of alcohol? Binge drinking is particularly dangerous for teens because the rate of alcohol intake is faster than what the body can respond to. Binge drinking is defined as 4 or more drinks for a female and 5 or more drinks for a male in 2 hours. The immediate risks of binge drinking include impaired judgment and alcohol poisoning. Long-term risks associated with binge drinking include harm to one's physical and mental health and alcoholism. Possible warning signs of alcohol use include changes in your teen's routines or behaviors. As a parent, you are the number one influence on your teen's decision not to use alcohol. Have frequent conversations with your child, provide consistent no-use messages, and set clear expectations around no alcohol use. Vaping, juuling, and e-cigarettes. E-cigarettes are the most commonly inhaled products among U.S. youth. Vaping by teens has rapidly increased over the past few years. Prevention and public health experts have learned a lot about the unique risks of vaping and e-cigarette use on youth health. Teens who vape are more likely to use other substances, including conventional cigarettes, may expose themselves to harmful chemicals, and jeopardize their lung health. It can be challenging for parents to identify vaping products. Many devices are small in size and can be easily hidden or look like common electronics, such as flash drives. Some vapes contain nicotine, a highly addictive substance. Some vapes contain e-liquid or e-juice, typically in sweet or other appealing flavors to teens. Many young people assume that they are inhaling harmless water vapor and do not realize that they are inhaling toxic chemicals. Other vaping devices can be modified for the use of THC oils or concentrates extracted from marijuana. THC produces a euphoric or intoxicating feeling and has psychoactive effects that can include altered senses, mood changes, changes in behavior, and addiction. Parents can look for physical or behavioral signs of vaping, such as strange or sweet odors, increased thirst or nosebleeds, decreased caffeine use, bloodshot eyes, or irritability. The industry uses deceptive practices to lure in young users with catchy marketing and sweet flavors to create lifelong consumers. Marijuana. Marijuana is the most common illicit drug in the U.S. at the federal level and is much more potent than marijuana decades ago. The active ingredient in marijuana is THC. THC is a psychoactive chemical that produces the high. THC interferes with information processing and can induce hallucinations. The risks of marijuana addiction are increased for users under 18. There are many different ways that people use marijuana, including rolling it up and smoking it like a cigarette or cigar, smoking it in a pipe, mixing it in food and eating it, brewing it as tea, smoking oils from the plant, or using electronic vaporizers. Edibles refer to food or drink that contain marijuana. Because THC is absorbed more slowly when ingested, this can lead to the consumption of very high doses, resulting in negative effects like anxiety, paranoia, and psychosis symptoms. Marijuana can cause both short-term and long-term effects when used by youth. In the short term, altered senses or an altered sense of time may occur. There may be changes in mood or trouble with thinking or problem solving. In the long term, teen marijuana use can cause health problems with brain development, which impact thinking, memory, and learning. Teens who use marijuana frequently may have long-term coughing and breathing problems. Opioids. Opioids, when taken as prescribed, can be effective to treat pain. Opioid misuse occurs when someone takes more than prescribed, other than prescribed, such as crushing a pill into powder, or taking it for the purpose of getting high. Opioid misuse may increase the risk of overdose or addiction. Opioids includes all drugs in the opiate family: natural, synthetic, and semisynthetic. This is a partial list of opioids that includes illegal as well as medically prescribed opioids. If your teen is prescribed an opioid after surgery or dental procedures, you can help reduce the risk of misuse by administering the medication to your teen and keeping the unused portion locked up until the next administration. The risks associated with opioid misuse include respiratory issues, addiction, accidental overdose, or even death. Opioids are particularly risky when used in combination with alcohol. If you have opioids in your home, keep them locked up and properly dispose of unused or expired medications. There is a drop box at the Ashland Police Station available year-round.